Hey everyone, this is Dr. Kevin Soriano at Cross County Cardiology. Welcome back to Whiteboard Wednesdays. Today we're going to be talking about what's happening inside your body during a heart attack. So on a previous Whiteboard Wednesday, we talked about the buildup of plaque in the coronary arteries and what that does to the arteries over time. Today we're going to talk about what happens when that happens all of a sudden, acutely, like a heart attack. So as you might remember, what we talked about last time was the blood vessel and how over time plaque forms in these blood vessels from high cholesterol, diabetes, smoking, poor exercise, stuff like that. Sometimes, and the reason for this isn't fully known, but sometimes this process becomes unstable, okay, and causes a little disruption in the process. The body doesn't like that. That's kind of like a foreign material that's sitting in your blood vessels, and so the body thinks it's doing the right thing by forming a blood clot there. So a blood clot starts to form very quickly on top of this little area, okay, and obstructs the blood flow to the rest of the heart, okay? So when this happens, as we've talked about before, you have 3 arteries in the heart, okay? And this feeds a whole bunch of muscle of the heart, okay? When there's a blockage, let's say here, all of this muscle of the heart is no longer getting good blood flow, and that's why you feel those symptoms. Things like chest pain, shortness of breath, some people feel lightheaded or dizzy, nauseous, a lot of sweating. When this happens, you need to seek immediate medical attention. You'll come see us in the hospital, and we do a procedure that's called a cardiac catheterization or coronary angiogram, which is where we put a small tube in through the wrist usually. We bring it up over here to the heart and put it right here in these coronary arteries that are blocked. And then with a little wire, we go down here, we inflate a balloon that pushes all this plaque and blood clot that's been forming to the side of the wall, okay? And then we put a stent in that keeps all that plaque up against the side of the walls and not obstructing the blood flow, okay? After that process, this area of the heart muscle will get its blood flow back. Hopefully you've come to the hospital fast enough, we've recognized this fast enough, where all this heart muscle will recover, okay? But regardless, we'll put you on a number of medications to help keep this stent open, prevent plaque from reaccumulating in that area and in other areas, and give you medication to make sure that all this heart muscle resumes its normal function. The summary of all of this is that the symptoms of a heart attack are things like chest pain, shortness of breath, lightheadedness or dizziness, nausea, sweating. If you're having any of those symptoms, you need to seek immediate medical attention. We'll take care of you. We'll do a procedure like this called a stenting, and hopefully save as much of the heart muscle as we possibly can. So thanks for joining us for Whiteboard Wednesdays. We'll see you next week.